need to make a disclosure regarding potential perceived conflicts of interest.
I have nothing to disclose. I think everybody will know this during the meeting. I'm on the Board of Health, so we can talk about that later, but that's obviously not a conflict.
Thank you.
No conflicts.
And neither do I. All right, we'll go ahead on to next item is approval of the minutes that are September 27th, 2022 and October 11th, 2022. All three county commissioners were present for both minutes.
Chairman Salka?
Yes.
I move that we approve the minutes from September 27th, 2022, and then the minutes from October 11th, 2022 for business meetings.
There's a motion. All those in favor?
Aye.
Aye. Passes. Minutes. All right, next is go ahead on to public comment and input. I would like to open the public comment portion of this meeting and turn that over to Sarah.
Thank you, Commissioners. This is Sarah, your moderator. If anybody in our virtual audience would like to make public comment today, if you could please raise your hand for me in Zoom. For those of you watching the meeting on a computer, tablet, or smartphone, there's a little raise your hand button at the bottom of your screen. If you're on the phone and would like to make comment, please press *9, and that will let me know that you would like to speak. While you raise your hand, I'll describe public comment. Public comment and input is an opportunity to comment on items that are on the consent agenda, matters that are under the jurisdiction of the board, and items which have not already been considered by the board. If the item that you would like to make comment on today is on the decision agenda, please wait until the comment, or wait to comment until that item is called up. The board limits testimony during public comment and input to 3 minutes per person, and not more than 10 minutes for a particular subject. No action will be taken by the board, and if you are watching the meeting, there's a time clock on the boardroom view that can help you gauge your time. And Commissioners, nobody in your virtual audience has raised their hand to make public comment.
Okay. Is there anyone here here that would like to address the county commissioners that is not on the agenda? All right. Seeing none online as well as here in the room, I will go ahead and close the public comment portion of this meeting. All right. Next is the consent agenda. The consent agenda is designed to approve projects in a single motion that, while important, do not require board or staff discussion. Do I have a motion to approve today's consent agenda?
Chairman Sullivan?
Yes.
I move that we approve the consent agenda as posted.
All right, there's a motion. All those in favor?
Aye.
Aye.
Aye. Consent agenda passes. All right, next is the decision agenda. We'll begin the hearing of the decision agenda with business agenda item number 1. May we please have a staff report on item 1, approval of intergovernmental agreement and supporting documents for the county community development block. Oh, sorry, I'm reading the wrong one. Sorry, I apologize. Agenda item 1, consideration of joint resolution number 2022-24 with Archuleta County establishing a plan and orderly dissolution of the San Juan Basin Public Health District. Staff report.
All right, Commissioners, Chuck Stevens, County Manager. I'll give the staff report for you this morning. All right, this has been a bit of a journey, so let's walk through it a little bit slowly and get you up to speed on where we are today. So first things first, as the board is aware, under Colorado law, each county in Colorado must have its own local public health agency or participate in a district public health agency. As the board's aware, La Plata County and Archuleta County, for many, many years, decades in fact, we have been participants in a public health district known as the San Juan Basin Public Health. That's a relationship that we've enjoyed and has worked for like I said, for decades. However, in 2020, 2021, there were some philosophical differences that began to arise, largely in response to the COVID pandemic and the response to that and public health's role in that response. But it's not all just about COVID. There's been philosophical differences that predate COVID as well. Our communities are just different. The pandemic response may have highlighted some of those differences, and in the fall of 2021, Archuleta County commissioners appointed an investigative committee to take a look at the public health district to determine its viability and to provide information about Archuleta's desire to remain within the public health district. While Archuleta County never took formal action on the report that came out of that investigative committee, it did cause the La Plata County Board of County Commissioners to also take a look at our role in the public health district in San Juan Basin Public Health, and was the public health service delivery meeting the needs of your residents, of your constituents here in La Plata County, or was there a way to do that better? At a meeting on April 28th, 2022, the Board of Health met, so this would be the San Juan Basin Public Health District Board of Health, which is an independent Board of Health, met, and they unanimously made a recommendation to both counties to dissolve the health district. And obviously, that's a big deal. This is a relationship that has been in place for a long time, and this is not a decision that I believe the Board of Health made lightly, or not a decision rather, but a recommendation. In June, on June 7th of 2022, La Plata County Board of County Commissioners had a work session, and you acknowledged the Board of Health's recommendation, and we talked about some of the different priorities and the philosophical differences between the residents of Archuleta County and what their expectations for public health were versus La Plata County's residents and the expectations of La Plata County's constituents with public health service delivery. And they really questioned what the regulatory role of public health and the services that should be delivered in our communities should be. So those were some of the kind of conversations that we started early in the summer. Board of County Commissioners gave staff direction at that time to what we refer to as a due diligence period, to do a little bit of digging and some staff analysis as to what it would mean, what would it take, what would it cost, what would the critical needs be if the board were to take action to dissolve the public health district and stand up a county health agency or a county health department, whatever that future might look like. So over the course of the summer, the staff formed an internal transition team. We met frequently, not only with San Juan Basin Public Health's executive director and staff, but we also met with the state, CDPHE, and we had lots of conversations and we asked lots of questions. Some of them were answered, some of them were not. We had a lot of information needs that remained, but we did develop a lot of information over the course of those months. The Board of County Commissioners continued to meet. We provided you a detailed staff report on August 23rd, in fact, and we talked about some of the different approaches that the board could take. We also talked about, again, the needs of our communities and how they're differing between La Plata County and Archuleta, and La Plata County's population continues to grow, and the public's increasing demand for accountability and maybe more local control over public health service delivery. On August 23rd, the commissioners again gave direction to pursue the recommendations of the Board of Health up to and including negotiations with Archuleta County, because it was the board's desire that if we were going to dissolve the district, the board had the option of doing it unilaterally. Either county could just unilaterally say they were going to withdraw from the district, and because there are only two counties that form the district, that would in effect dissolve the district. That was not the board's desire or intent, and we gave direction to staff to negotiate with Archuleta County with the hope that we could come to a joint resolution that both counties could agree to dissolve, not only on the same day, but along the same timeline. If the Board of County Commissioners had unilaterally decided to withdraw, that would have started a one-year clock that would have started immediately. So that shot clock would have begun. By doing a joint resolution, we had a little more control over establishing the timeline for which to dissolve the health district and simultaneously stand up whatever the future of public health is going to look like in each of our counties. So those negotiations started and have been completed. And what you have before you is a joint resolution. You have two items before you today. Decision item number 1 is a resolution. Decision item number 2 is an IGA. Right now I'm talking only about the resolution. So what you have before you for consideration is a joint resolution between La Plata County and Archuleta counties to dissolve the public health district, San Juan Basin Public Health, effective December 31st of 2023. It's our intent and desire, and as is stated in the joint resolution, that we want to do so in a planned and orderly process, because our top priority is making sure that we minimize any disruption of public health service delivery to our constituents in either county. So that's what this joint resolution does. The fiscal impact, and I know this is a question that we've been getting a lot. So we're making a lot of assumptions right now. We're also working with a consultant group that is helping us do some analysis to really dig into what the cost of establishing our own county health agency will look like. As the board is aware, in the proposed 2023 budget, we've included $750,000. We've created we're proposing to create a new fund. So instead of the 4 major funds that we always talk about in the Plata County, we would add a 5th, and that would be for a county health agency, county health department. We're not sure what it's gonna look like just yet. We've included $750,000 in there. That's our estimate. That's an educated estimate based on our analysis that we've done. We know that as we transition and start to bring over some programs in 2023, hire some people in 2023, we are going to incur some costs. If we get the report from our consultant before December 6th, there's a chance that we might modify that number. If that happens, we'll let the board know, and then obviously we'll brief that to you on December 6th when you consider the budget for 2023. But as of right now, we're anticipating the startup cost is $750,000. We're also considering that to be a one-time expense, so that's going to come out of our general fund balance as a remember your fund balance. It's appropriate to use fund balance for either capital or for one-time expenditures. We're considering this a one-time expenditure, so we're using fund balance to fund this. And then, as I've said before, as we progress into this and we actually stand up a county health department, we'll begin to realize what the actual operating costs are, and over time we'll be able to look back and document, and of course the audit will capture all the actual expenses and we can report that out. Right now, the $750,000 is our best educated guess. If our consultant group comes back with a different number, we'll present that to the board prior to the 6th, and then we'll brief it on the 6th as well. So our recommended action for the board today is that you approve and execute the joint resolution by and between the counties of La Plata and Archuleta of the state of Colorado, dissolving the district public health agency, San Juan Basin Public Health. And I'm happy to answer any questions if I can for you.
All right, thank you. So commissioners, we have 2 items here on the agenda, so we'll just focus right now just on the joint resolution. Questions?
I just want to say that this is not a question, it's a comment. I just want to say that we want to make sure that the transition is smooth and that the public health programs aren't compromised for either county as we make this transition. So that's very important, I think, to all of us. We've talked about this extensively over the last several months, and it looks like it is doable. So thank you.
Yeah, Chairman Salka, I have a statement. It'll take about 2 minutes, I think, because I am the Board of Health representative. So I think it's important for people to know, but you may want to proceed.
Do you want to, would you like to do that before I open public?
Let's do it after the public. I think, yeah, let's do it after the public. And Chuck, thanks for your report. And my lack of questions to you, as Commissioner Church alluded to, are because we've been in a deep dive here ever since June, and so I don't have any questions. Thanks.
Yep, and just for myself here, I'm glad that County Commissioners for Archuleta as well as La Plata County working on this joint resolution. Thank you to staff on both counties on working on this, and I'll go on now to the next step here, and that will be opening up this agenda item to public comment. Anyone wishing to address this issue, please limit your comments to 3 minutes. The board will take your comment into consideration but will not respond to each comment. Please state your name for the record before you begin your comments. And before I turn it over to you, Sarah, for online, this is for the item agenda 1 for the joint resolution. Here later on today, I'll address the the listening public on our next steps, at least our current next step here for tomorrow. We really don't see the vision just yet. We're working on those items next, but this is just for the joint resolution, item 1. And I'll turn it now over to you, Sarah.
Thank you, Commissioners. This is Sarah, your moderator. If anybody in our virtual audience would like to make public comment on this item, if you could please raise your hand for me in Zoom. For those of you watching the meeting on a computer, tablet, or smartphone, there's a little raise your hand button at the bottom of your screen. And if you're on the phone and would like to make comment, please press *9, and that will let me know that you would like to speak. And I will give everybody another few seconds to raise their hand. We have Gary McMurdy, who's raised his hand. Gary, I'm going to go ahead and bring you into the room. And
Okay,
go ahead.
can you hear me?
Yes, I can, thank you.
Okay, coming into this a little bit late, I was wondering, he talked about differences and expectations between the two counties, and I was wondering if you could elaborate on that a little bit.
We typically don't, Gary, what we'll do is, here, Sarah, can we post in just contact information on how they can get a hold of us so we can get those type of questions answered?
I sure can, thank you.
Thank you.
Thank you very much.
We'll get your answers, your questions answered for you, Gary.
Thank you.
As we're waiting for the online listening public to raise their hand on public comment for 3 minutes, I'll go ahead and anyone here in the room that would like to speak, please step forward. Okay, I have no one here in the room, Sarah. We can turn it back to online if there are any.
You know what, nobody else has raised their hand.
Okay, all right. Thank you. All right, we'll go ahead then and close the public comment portion of this agenda item. And are there any comments or questions from the commissioners? Commissioner Porter, if you would like.
Sure. Yeah, this I think will take only 2 minutes, but I really feel like this is a huge day. It's a huge day for Archuleta County and La Plata County, so I wrote out some comments ahead of time and wanted, of course, to hear what the public had to say. I ran for office to create healthier communities, and I believe that a dissolution of the district will create healthier communities for the constituents we serve. Regarding, this gets to the public members' question, at least maybe a broad overview, but regarding some context and reasoning for my support for a dissolution, I go back to the April 28th meeting of the Board of Health. At that meeting, where the specific purpose was to determine the future of the district given ongoing tensions, conflicts, and disagreements among the two counties, the Board of Health made a recommendation to disband in an affirmative vote of all present. And we then received that report as our county manager relayed. This was then reiterated again in a follow-up work session that the Board of Health had with us as commissioners. While in all honesty, disagreements between the two counties were certainly exacerbated by the pandemic, these problems date back, and these differences of opinion, they may be are always problems, but just different views, date back many years, and a dissolution was also contemplated. Many people don't realize this, back in 2009. So 13 years ago, we were in the same spot. As a commissioner, I rely on the Board of Health volunteer citizens who give hours and hours and hours of time, of expertise, and they care about everybody. And I take what they say very seriously, and that board has spoken to us. They believe a dissolution is in the best interest of the public of both counties, and I agree. If the public is wondering, which somebody is today, what led to this, I would refer you to 3 things, and I'm not going to elaborate today. I don't think this is the time or place, but anybody that wants to do some research can find it. First of all, I would refer to the Board of Health report itself, and that was the April 28th document. On page 2, it says county views of the regulatory role of public health in each community are seemingly very different and have made the work of San Juan Basin Public Health Department at times challenging. I think that's a bit of an understatement. I think the report was written for broad audiences, and it has been very challenging. On page 3 at the bottom, and it's a 3-page report, easy to read, it said, it is the recommendation of the Board of Health that the current district be dissolved and each county pursue their individual visions for public health services. There are longstanding differences in the way that these two counties view the regulatory role of public health and the services that should be delivered. The perceived and expressed desire for more direct management of public health services to suit each agency's needs can be best met by separation, and it goes on. A Durango Telegraph article by reporter Jonathan Romeo gave an accurate, helpful timeline, and that was written on September 1st, 22. You can find it, and I don't think they have a paywall. It's easy to read. I went on record with my fellow commissioners at a board discussion time back in September detailing my specific reasons as a member of the Board of Health that I felt like a dissolution, we had no other choice. I said that I believe public health delivery and governance is being harmed by the differences in values and desired public health delivery strategies among the two counties. All of this and more has resulted in a corrosive impact on public trust, collaborative board and community relationships, including, importantly, I feel this situation has been harming the staff. On that note, we need to support the excellent staff to whom we owe a giant debt of gratitude, especially so now because they have been delivering all the regular public health programs that we've been hearing about at BDT while also managing a 100-year event called a global pandemic. It's pretty amazing what you all have been doing. I know that this dissolution has probably been weighing very heavily on the staff's minds. I'm sensitive to that, but they have done an excellent job of keeping the ship righted, and we will need to continue to rely on their expertise, their patience, their tenacity, and their flexibility during this time. So some good news and bad news there for the staff. I think we're gonna have to continue to rely on you being very nimble. In closing, I believe the dissolution presents an opportunity to put in place a structure that is more collaborative, more locally focused, and more nimble, because if the pandemic has taught us anything, it is that unexpected events can have consequences right here in our communities. And I believe here we had 92 deaths. But I take no joy in this vote. It is not a time for gloating, and it is not a time for hard feelings between the two counties. We have a lot of shared interest with Archuleta County. I believe they are putting in place mechanisms by which they can look at what their public health department looks like, and I think that's very exciting. We also share everything from broadband goals to shared services goals, and we also run we fund a judicial district, partially fund. So we have a lot of shared interests with this county, and I think it's a great opportunity for them. Again, I take no joy in this. This entity has been around for 75 years. But it's obviously based on all these facts, time for public health that is closer to home in light of the fact public health is delivered through state and federal requirements, and there are many of them. So it's not only going to be a local entity. My vote today is an obvious yes, and we will do everything. I think we all need to pledge to do everything possible to make this transition smooth, and always keep in mind why we're here, which is to serve the public. I really want to thank our staff. They have regular jobs, and the staff at Juan Basin Health as well. And so they've been doing this due diligence process in the context of their regular jobs, and it's been a very heavy lift. You can tell by the IGA, and you can tell, I'm sure when we get the AUDOE report, we will see the incredible work that has gone into this. But I think this is a great opportunity. We're not tearing something down, we're taking something that is excellent and making it even better. So I felt like I owe the public an explanation of where I'm coming from on this, so thanks for your time.
Thank you, Commissioner Porter Norton. Anyone else?
No, I think it's a tremendous amount of work that's been done by staff and attorney's office and county staff. I want to say thank you, and I think it's been a great deal of
Commissioner
work.
Church, please lean into the mic.
I think it's been a great deal of work also in Archuleta County as they get ready for this, so I'm well up on it and feel comfortable with this move.
Great. Thank you, Commissioner. Commissioner Porter Norton, thank you very much for that. I'll just highlight two items that I had on my notes, and so I won't keep repeating things, but this will be, for myself, will be locally focused, as well as local collaboration for the county health department, and I look forward to the many meetings that we will have on shaping that for our future here in Plata County. And most importantly, thank you very much to Plata County staff on working all of this. This was a tough task to have. Thank you. All right, I'll go ahead then. Next is entertain a motion for agenda item number 1 for the joint resolution number 2022-24 with Archuleta County establishing a planned orderly dissolution of San Juan Basin Public Health District.
And bringing it up. I was ahead of the game. Mr. Chairman,
Yes.
I move that we approve and execute the joint resolution by and between counties of La Plata and Archuleta of the state of Colorado dissolving the district public health agency San Juan Basin Public Health.
Thank you. All those in favor?
Aye.
Aye.
Aye. Agenda item number 1 passes. Thank you. All right. Next is consideration of intergovernmental agreement establishing a planned and orderly process for dissolution of San Juan Basin Public Health and facilitating the smooth transition of public health services to the counties. Staff report, please.
Yes, Cheryl Rogers, La Plata County Attorney. So with the adoption of this joint resolution, the dissolution of San Juan Basin Public Health will be effective as of 11/59 of December 31st, 2023. Therefore, we have a little over a year to establish our own single county health department and to also dissolve San Juan Basin Public Health in an orderly fashion. The intergovernmental agreement before you today discusses the mechanics of how that's going to happen. There are 3 parties to the agreement: La Plata County, Archuleta County, and San Juan Basin Public Health. The IGA also brings a 4th party into the equation, and that is a receiver. So Colorado law does not have any details on how a public health agency should be dissolved. And so what the IGA contemplates is that San Juan Basin Public Health will commence an action in our district court here locally and ask for the appointment of a receiver. And in that way, all the parties have sort of the legal cover and administration by a judge to ensure that it's all being dissolved appropriately, and it also helps achieve that in a transparent manner. The IGA deals with 5 categories of issues. The first is the disposition of real and personal property. Attached to the IGA is Exhibit A, and that lists the most material assets that the entity has. Some assets will be transferred to individual counties so that those assets are available to either La Plata or Archuleta in their continued use of providing public health services to their community. And Exhibit A makes some assignments of those assets of how they're to be distributed. The most significant of the assets are the 2 buildings that are owned by the health department. There's one in Archuleta County and there is one in La Plata County. And what it contemplates is that La Plata County will keep the building out on Sawyer Drive and Archuleta will keep the building that's over in Pacosa. Each county will have the option of either accepting title of those buildings or we can actually decide to dispose of them. If La Plata County determines we have plenty of office space and we don't need more, or the building doesn't really suit our purposes, then we would have the opportunity to do that and then keep the proceeds of that for our own county health department needs. With all of the assets, the intent is to have an equitable distribution in proportion to the population of each county. That language is in there because that is how we have been funding San Juan Basin Public Health and what the statute requires. It's determined on a per capita basis and will rely on the numbers of the demographer's office for the state of Colorado in determining that at any point in time. The second category of assets are cash on hand. The health department has bank accounts. It'll continue to utilize and draw from those accounts until December 31st of 2023. After that date, the receiver would take care of the payment of any creditors that might be outstanding. And then what's remaining, the remaining balances in those will be distributed to La Plata and Archuleta in proportion to each county's population. The third category are contractual obligations. There's not a lot in this category. There's some copier leases and we'll evaluate those. The department does though have 41, I think we're in the 41 category, we might have added a couple of additional contracts, and most of those are related to grants or funding for the various programs that they administer. Those contracts will not be assigned to us. We will be evaluating those on a program by program basis and entering into new contracts depending on whether we desire to move forward, have that particular program continue on our single county efforts. The fourth category are software contracts and licenses. As you're probably aware, these aren't typically assignable. So San Juan Basin Public Health will provide us a list of the different software that they use and is necessary to fulfill their statutory obligations, and then we'll have an opportunity to procure those ourselves. And then fifth important category are records, and what an item that might be of interest to the public are the records that pertain to clients and patients. So the process that the IGA lays out is that those clients and patients will be notified about the dissolution. They will have an opportunity to receive their records or to have those transferred to an alternative provider. Last, the IGA also talks about personnel. So throughout 2023, the health department's employees might have a dual function. They'll keep performing their current jobs, but each county acknowledges that some time and effort by those employees can be dedicated to an individual county to help them stand up their department, so that eases the transition. Then we've had a lot of questions about what are the status of the employees after the dissolution. So La Plata County will form a new Board of Health. Archuleta County is still exploring, whether they want a standalone or to join another district. But after we form a new Board of Health, that Board of Health is responsible for hiring the public health director. It doesn't lie with this board, it doesn't lie with the county manager, it's the new Board of Health. That director then will hire employees for our county department under the Equal Pay for Equal Work Act that was passed by the Colorado legislature in 2021. The county is required to advertise all of our positions as new positions and to notify existing employees of promotional opportunities and to also list compensation in the advertisement. So legally, we're precluded from just moving folks over wholesale. So the advertising that we'll be doing is not at all a reflection on any employees. It's required by Colorado law. And so the hiring and the onboarding will occur as it does with any other recruitment process for a county position. So in closing, I guess I would like to acknowledge not only the work of my own staff, Jessica Mitchell, but to also say that we could call this a negotiation, but it was actually a very congenial effort by the legal staff of all three entities. There's no animosity, there were really no hotly contested issues. I think it bodes well for our ability to cooperate over the next year and into the future between the two counties. So I'm happy to answer any questions you have.
All right, commissioners, questions on agenda item number 2?
No, I've been through this and familiar with it, so no questions.
Chairman Salcom?
Yes.
I don't have any, well, just a couple questions, and partly because I know we have a lot of people listening in. This is, we have the Durango Herald here and probably some other media online. So I also want to commend our staff for giving us the guidance of doing the kind of due diligence that we've done on this. I mean, we have taken deep dives into all of this. And towards that end, we are going to be getting a report soon from the Ottawa group. which I believed helped with a similar process up on the Front Range. In that, can you talk more about, and we don't have to have all the answers today, but the public, one thing I'm hearing from is people that have their program that they really like or that they really know about. Whether that's the WIC program or the restaurant inspection program, or, you know, there's so many wonderful things that public health does. How will, and you can keep it at the 100-foot level if you need to, but how will we proceed with saying, and I've also further heard, well, we're gonna lose those programs. So there's an assumption being made on this part of some people, I think, that this automatically means a loss of programs. How will the ODOE report help us in light of these 41 state contracts, and then in light of setting our own priorities? How do we negotiate all that over the next year?
So we have asked ODOE to assist us in right sizing our single county department. That's with respect to staff, and then maybe also making recommendations about programs. They're looking at other comparably sized counties, because most counties actually have single county departments. There's other districts, but they're gonna provide that information to us. Also a greater understanding of you know, what is the normal per capita amount to which public health is funded, but it will ultimately be a decision of the Board of Health on what the programs are, and the Board of Health is subject to the same open meetings laws, open records, all the public transparency that currently exist, and you know, they will be sensitive to the needs of the community, and then also the recommendations of the public health director.
And I'm assuming that also many people, again, I think this has been an interesting opportunity for us to all as a community learn more about public health, but things that are mandated by the state. We have a set of mandated services that we must do, okay?
Correct.
So as we get the ODOE report and get the Board of Health seated, we can begin to really dive in and say which ones do we keep, and the money we have allocated for 23 could be bridge funding, and then later it is, I think Chuck said in a previous meeting, we would be on par, I think is the analogy you use, that yes, we've invested $750 for 2023, but depending on how all of this goes, we would certainly anticipate and project that we get that money back, so to speak, I think. Maybe not dollar for dollar, but certainly a good investment. Who on our staff is going to continue to manage this? I know it's gonna be your office, the county manager.
Yeah, we basically have primarily 4 departments: human resources, finance, administration, and the county attorney's office.
Okay, thank you for all your work. That's all I have, so lots of work to do. Again, we're not tearing anything apart, we're putting it back together in a different way and a more local way. So those are my questions, thank you.
All right, thank you. So again, I'm going to open this item up for public comment for agenda item 2, which is an IGA agreement establishing a planned and orderly process for dissolution of San Juan Basin Public Health and facilitating the smooth transition of public health services to the county, to the counties. And just for the listening public here as well as online, you can see these agreements. This is all public information. All you have to do is go to La Plata County's website for under meetings, and you'll be able to see these actual items of what we're discussing too. And also too, as well as future meetings. For example, will be tomorrow at 12 o'clock will be a work session for the county commissioners on discussion of options for structuring a new La Plata County Board of Health. So there's more items that are going to be coming forward for the public to be able to listen in on. And as we go through the process of the dissolution of San Juan Basin Public Health by the end of December 31st, 2023. All right, so I'll go ahead and open up this to item 2, public comment. And anyone wishing to address this issue, please limit your comments to 3 minutes. The board will take your comment into consideration, but will not respond to each comment. Please state your name for the record before you begin your comments, and I'll turn it over to Sarah.
Thank you so much, Commissioners. If anybody in our Zoom audience would like to make public comment on this item, please raise your hand for me in Zoom. For those of you watching the meeting on a computer, tablet, or smartphone, there's a raise your hand button at the bottom of your screen. And if you're on the phone and would like to comment, please press *9, and that will let me know that you would like to speak. We'll give everybody another 5 seconds or so to raise their hand.
Is there anyone in the room that would like to speak on this item? All right, seeing none here in the room. Sarah?
And nobody in our virtual audience. Thank you.
All right, thank you very much. All right, I'll go ahead and close the public comment portion of this meeting. And are there any comments or questions from the commissioners? If
I don't.
not, then I would entertain a motion for agenda 2.
Chairman Solga?
Yes.
I have a recommended action to approve the attached intergovernmental agreement establishing a planned and orderly process for the dissolution and wind-up of San Juan Basin Public Health and facilitating a smooth transition of public health services from San Juan Basin Public Health with signature authority to the board.
All right, there's a motion. All those in favor?
I'm
Yes.
sorry, signature authority for the chair.
Oh, I'm sorry, signature authority to the chair.
Okay,
Correction.
thank you. There's a motion. All those in favor?
Aye.
Aye.
Aye. Passes. Thank you. All right, again, please reach out to your county commissioners and or also online. There you have posted the phone number and the email address. If you have any questions, please reach out to us, and we'll let you know on links and dates too as well on the next steps here. Thank you. All right, that is all I have here today, so I will call this meeting adjourned. Thank you, everyone.